So if that is the diagnosis, we'll make it easier on Michael. We'll just call it frozen shoulder. Most people recognize it as that, and that's what it is. It's a shoulder that's extremely stiff. It's one of the two major reasons for people to get shoulder stiffness, the other being arthritis. And it's an interesting condition because we don't know what causes it. We used to think that diabetics, which is why she mentions the A1C, had a higher propensity for it, but recent research has shown that we don't really know if that's correlated or not. So we don't know what causes it, which makes treating it a little bit difficult. But we also know that it's a self-limiting disease, meaning that it will go away eventually, but that eventually can take up to 2 years for it to thaw out and loosen up on its own. So if you can tolerate it for that long, then you can be rest assured that eventually it'll loosen if that's actually what it is. Now there are two types of adhesive capsulitis. The primary adhesive capsulitis or frozen shoulder is what I just described. Self-limited, no known cause. Somebody wakes up one morning, the shoulder's hurting, and then over a few weeks it stiffens. It's very painful. It's difficult to get it moving again. And it comes in 3 phases. Now, you have to forgive us orthopedists. We're incredibly smart, but we like to dumb it down so that we can remember everything. The first phase is something we call the freezing phase. And then there's this frozen phase, which is stiffness but less pain. And then thawing phase, which is generally just a longer term, and it's less painful and the motion just generally comes back. So depending on how long the patient that is asking this question has suffered from this, you can kind of determine which phase they're in. We don't do any intervention, surgical or non-surgical, during the freezing phase because it just makes things worse. But during the frozen phase, you try to maintain the amount of motion that is there. And usually that's a physical therapy type thing, which can be done with a therapist or at home. We often will inject them with steroids. There are a couple of intra-office procedures that I've read about recently. Tried it one time, not sure I like it, but you may hear something called hyperdilation, which is where we numb up the shoulder, stick a very large needle with a bunch of saline in it, and we just push until the capsule pops. And hopefully that will loosen the shoulder. Sounds awful, but it's not as terrible as it sounds when we do it. And some people are using ozone. I've never injected that myself, but I know a lot of pain specialists are doing things like that. Where was I? In the thawing phase, if you've reached the thawing phase where it's less painful and it's already loosening, then just let it, run its course. There's really not a lot you have to do with that. So it's those people in the frozen phase, whether they can tolerate the length of time where their shoulder is trying to get through that. And that's the most frustrating phase because it is painful and it is very stiff. And so it's difficult sometimes to manage through that portion of it. But if you're mentally tough, you can usually get through it. Surgical treatments for a frozen shoulder. Oh, wait, I got to go back. We talked about primary. The secondary frozen shoulder, this is a little more tricky because what happens is something else is wrong with the shoulder, a rotator cuff tear, a slap tear, a dislocated AC joint or shoulder, where the patient just kind of supports the arm and doesn't want to use it. Then it gets stiff. That's something that comes as a secondary cause because the patient doesn't want to use it. That is usually very treatable because if you treat the underlying problem, then the shoulder can start moving again. It's less painful, and that goes away a lot quicker, usually within 3 to 4 months after you've treated the underlying problem with the shoulder. So you have to decipher which type of frozen shoulder that you're dealing with first. Surgical treatments for primary frozen shoulder they're somewhat barbaric.
Oh, gosh.
So because this tissue we call the capsule, which is why they call it capsulitis, is usually very thin and pliable. It's stretchy. The problem in that condition is it gets very thick and rigid. So we can take it to the operating room and force the shoulder to go where it belongs after putting it to sleep. And it does make these audible sounds of popping, crunching, cracking, but it usually gets their motion back quite readily. Then they go immediately into physical therapy after that to try to maintain the motion that we've achieved in the operating room. So Not a lot of really great advancements on the frozen shoulder side of things, but people are trying new things all the time. I would just be cautious about, like I said, who's injecting you with what they're injecting you. You just have to be careful that it's a safe sort of procedure for them.